think the results of the research should be accessible to everybody. And one of the main aims of my work is to try and bring the studies that we have in research, the nice publications, into a real-life setting where it is a tool or a change in treatment that actually makes a difference to a patient's life. But I think there's a lot of things that have to change to allow you to go from a research publication to a implementation stage. So it's a bit of a process, but yes, that's the aim, that we bring it to the people. I think the way we think, first of all. So I think that the old way of doing it is to do a nice research study, and you're doing the study because you have an interesting scientific question you want to ask, but you don't really think at that point about the implications for the patient directly. Often in research grants, they will want you to say something about how it will help the patients, and it's just one sentence that someone writes saying, and we hope this will help the patients, or this will, have an idea that will lead to some change. But actually we need to be much more constructive and careful about, at the start, thinking, okay, these are the results, or this is how we're going to do it. How could we do it in real life? What are we doing in research that we can't do in real life? What can we change down the line to compensate for that? So you might do whole genome sequencing that might take 12 weeks. Can you do something that's a little bit smaller than that you could do in less time and put it into the clinic? So there's lots of changes that if you think about it early, you can start to anticipate the difference between the research setting and the real life setting and make that change early. I mean, I think that the other change in mindset is exactly that, about collaboration. So, one of the most powerful things that we've all discovered recently, or not recently, we've known forever, that data matters, right? And of course, the more data that you have, the more questions you can ask and answer, but also the more signals that don't matter are in there. So it's about using the data, sharing data, coming together, and sharing it in a way that acknowledges the work of the teams that have taken the time, effort and money to deliver those results, but also getting the full value so that we can use it for people everywhere. So that there are always risks. So obviously when a patient comes into a research study, they have to consent. There is a misunderstanding sometimes that consent is just a piece of paper. Consent is a process, and the process involves the form that you sign, the conversation with the doctor, the information leaflet that you get. That's all part of the consent process. And it's the researcher's responsibility to make sure that they and anyone else who uses the samples adhere to those guidelines that they have explained to the patient. Having said that, once the patient gives you the sample with their permission, and you remove the sensitive data about who they are, where they live, those kind of things, then the de-identified data, as that is called, should be able to be used widely. And these days that's written into the consents in many trials, that actually de-identified data can be shared. So in Cambridge we are in just about to, next year in fact, the spades will go in the ground to develop a new Cambridge Cancer Research Hospital. And one of the reasons that the government in the UK has partly funded that hospital is because we believe that we should be developing tools or methods that can be used not just in Cambridge, not just in the region, not even just in the UK, but that could be used anywhere. So tools that, for example, might be able to predict whether your patient is going to respond to a treatment. These could be cloud-based or things that people can access remotely. So it's about taking the expert to the patient rather than bringing all the patients to the hospital. And so if you live, just in our region, if you live near the coast and you don't live near the centre of Cambridge, it's a long way when you've been diagnosed with something to come to Cambridge and have all that while you're under that stress. So if you can stay where you are, but the doctor who's looking after you there can put the information in that we need to make these decisions, we can share that back to the doctor and the patient can be treated where they live. And the whole approach of the new hospital is really to say, only come to the hospital if you really need to, but we want to enable you to be cared for where you are, wherever possible, and share that expertise. So trying not to move the patient so much, but move the expertise.